So we see a lot of patients with lower back issues, and there's some really common type of misalignments that lead to the majority of these sort of problems. So I'm going to walk you through what we see a lot of and how we tend to correct it. So on the left is a normal example of a front view lower back x-ray. So when you look at the x-ray from the front, the spine should be straight and the hips should be level. So you can see her x-ray, her pelvis is rotated. She's almost 7 millimeters low on that left side, and it's actually created some slight scoliosis, so there's some curvature, and that's putting stress and damage on the joints, and it can pinch the nerves, creating stuff like sciatic. And so we're going to do a light adjustment and kind of walk you through how we tend to correct these sort of misalignments. So the first way we can do it is utilizing the table and doing some drops to help specifically correct that rotation in her hips. So this pops up, and that's going to help to balance that rotation that we saw. The other way that we can do a corrective adjustment is I'll have her lay on her side. And it's more of a manual adjustment, and we stretch and we do a correction just like that. Now, the other thing that we see a lot of is a loss of curvature in the lower back. So ideally, when you look at the spine from the side, you will see these perfect curves. And those curves are critical for strength and stability. That's what protects the joints, it protects the discs and the spinal cord. So from the side, we should see this perfect 35-degree curve. So again, here's our normal. The disc spaces are wide open. All the weight is back here on the posterior part of the spine, so it's very strong and stable. On her x-ray, you can actually see very straight and almost a little bit of a reversal in this lower part of her spine, which will load the disc and create a lot of back issues. Muscle spasms, it can create degenerative disc issues. You're significantly higher risk of herniating the disc, creating things like back pain or even stuff like sciatic. So let me kind of show you how we correct that adjustment. So for this, we're going to use the arthrostem, and the arthrostem is actually one of the only chiropractic adjustments that's actually known to help correct the curves in the spine. So we're going to come right through here. And patients really enjoy this adjustment, especially if they don't like the manual adjustments or the popping or cracking. But that is how we're going to start to correct that curve to make her spine stronger and more stable.